To understand American healthcare, one need to look no further than the most recent exclusive reported on the news with Dan Rather to understand how we even define healthcare. American healthcare is not defined based on any level of engagement, activity, observation, treatment, education, any activity or action or even thought that relates to improving the health of a human being. Instead, healthcare in America is based on the ability for private companies to extract as much money as possible from individuals while paying out as little as possible by either not providing any health coverage or sickness treatment, really, because it's not really health coverage, but sickness treatment to anybody, or when they do have to provide sickness treatment to anybody, to shift that cost away from the private company onto the government or some other third-party provider. So the vast majority of the resources at our so-called healthcare companies, and I emphasize so-called, is spent employing individuals whose primary task is to figure out either how not to pay to provide any benefit to someone who is sick, or to try to find a government entity or third party that can absorb that cost while collecting as much money as possible from individuals and institutions in the name of healthcare. The rest of the world views the American view of healthcare as basically a predatory system designed to destroy human beings for the enrichment of a few individuals. When you look at this most recent report, that view of the American healthcare system probably is too favorable. To say that America should be ashamed is surely too small of an indictment. And I offer my compliments to the reporters and, of course, to Mr. Rather for bringing this particular example of how egregious the abusive nature of our healthcare system is to light, such that people can actually come to understand it, even if ultimately our political system, due to gerrymandering, closed primaries, closed debate stages, etc., doesn't really allow a political solution. At least we do have the awareness to understand what the system is, so that at the very least we can focus on maintaining our own health, lest we become product for this system.